Renowned lawyer and anti-corruption crusader Prashant Bhushan needs no introduction, but he's in the news now for lighting a dangerous vaccine hesitancy fire on social media that's going viral. Prashant Bhushan has nearly 2.5 million followers on Twitter, and he's been tweeting a series of rants that directly attack the need for COVID vaccination. Prashant Bhushan has now gone on to make dangerous and specific claims that have been unanimously bashed, criticized and refuted by experts, doctors, even his own friends and allies on social media. In one tweet, for instance, Prashant Bhushan claims that the healthy young have hardly any chance of serious effects or dying due to COVID. They have a higher chance of dying due to vaccines. Can you imagine? Prashant Bhushan has actually says that. It's an easily disproved claim that could spark serious vaccine hesitancy in a country where hesitancy is the true virus. With nearly 2.2 million followers on Twitter, Prashant Bhushan's anti-vaccination rants have sparked outrage even among his supporters, who've demanded that Twitter tag his tweets as dangerous misinformation at a time when vaccination needs to be India's top priority. Prashant Bhushan, however, is brazening it out and has publicly declared that he has neither taken nor intends to take any COVID vaccine. The fact that he's a high-profile lawyer with a large following has presented itself as a serious threat. He's entitled to his views, and of course freedom of speech applies in many cases. But in a pandemic, at a time when hesitancy is a major issue in the country, is dangerous misinformation and easily disproved falsehoods of this kind masquerading as opinion really to be allowed? His word holds weight to millions of followers in his audience. Neither Twitter nor the government have taken any action so far on his claims and statements. But like I said, doctors in the country have united to bash this vaccine basher.
Each one of us was waiting in great anticipation for the vaccine to come. Now, when it is available to each one of us and the vaccination drive is on, let us all join hands together and take the vaccine. Do not be fearful. Let us help one another, our neighbor, our city, our country and the whole world. That is the only way to fight the pandemic. Unless we join hands, this pandemic and COVID will be here to stay. Let us pledge to take the vaccine. Vaccine first is the mantra.
Vaccination is the only way to get out of this menace of COVID. The more people get vaccinated, the quicker we will be able to get out of this mess, and also we will be able to save more lives. There are few tweets out there which discourage you from taking the vaccine. We need to keep away from these naysayers, discard them and go get your vaccinations when you are due for it or when your turn is in. Let's make ourselves COVID-free as fast as we can.
I got myself vaccinated against COVID-19. Have you got your vaccination done yet? Even pregnant and lactating women can now take the vaccine against COVID-19. Remember, vaccinations protect us against infections. So, to protect yourself and your family members against COVID-19, don't forget to go and get yourself vaccinated. If you haven't till now, tomorrow, the first thing in the morning, please go and get yourself vaccinated.
It is imperative that ones who are eligible go there and get themselves vaccinated. Vaccination is the only way that we can win over this pandemic. The vaccines available today have proved their efficacy, safety, immunogenicity, and thus it's a no-brainer to take your vaccine. We have been successful in eradicating smallpox because of vaccination, polio because of vaccination, and to a great extent, several other diseases have come under control surely by vaccination.
The vaccine is efficacious in reducing not only the severity of the disease, but it also reduces the chances of person-to-person spread. A person who is vaccinated, if that person gets COVID, his chances of transmitting it to others are much lower. It reduces the severity. Even if you do get COVID, the chances of dying from COVID are minimal. And one is considered fully vaccinated only after 2 weeks of the last dose have gone by.
The only way to help out in prevention of COVID is by giving vaccinations. This should be the best strategy. Those who are unvaccinated, they endanger their lives, lives of their families, as well as the society. Also, these unvaccinated people, they are an obstacle in breaking the chain of transmission of this disease. We should follow the advice of medical experts about vaccination, vaccination strategy, timing, etc.
COVID-19 vaccines are indeed safe. Age is an important factor in determining the risk of severe COVID-19 disease. However, everyone, regardless of age, is at risk of getting infected and potentially infecting others. For that reason, it's important for you to get your COVID-19 vaccine as soon as you are eligible. Getting your vaccine can help protect you and those around you. Again, these vaccines are safe. Both vaccines being widely used in India right now have been tested in a large number of people who have been followed for several weeks and months. Based on these data, both of these vaccines have been deemed safe by the Indian government and several other governments as well.
He goes on to say that COVID recovered will develop better immunity than the vaccine. But when you say COVID recovered, Mr. Bhushan, you are presupposing that the patient has already suffered the disease, and the way the disease is panning out these days, there is absolutely no guarantee as to who will suffer serious consequences, and who will recover. The vaccine at least guarantees that the severity of the attack, should you suffer it, will be of a lesser intensity, and you are less likely to land up in an intensive care unit.
See, crores of people have taken vaccines in the world, and it has been proved that if you take vaccine and you are a little careful, then your chance of getting COVID is very less. And if at all you get COVID, it is very mild, and chance of hospitalization or ICU requirement goes down. Plus, chance of death also goes down. So please don't listen to unauthorized or non-medical people who talks against vaccination. So you take the vaccine or face the consequences.
And those are the experts speaking. It's not just us saying it. Those are the experts who've bashed Prashant Bhushan, this new high-profile vaccine basher who's been speaking to his millions of followers on Twitter and in one way being seen to encourage vaccine hesitancy, even though he says he's not. This is his opinion. He says he's never tried to instigate hesitancy, but that could, of course, be the side effect because he's a credible lawyer and a person who is seen to be a person with opinions that need to be taken seriously. These are the big questions we're asking here on India Today. Is this a free speech issue when misinformation is being spread in this manner? And you've heard what the doctors have said. Is Prashant Bhushan actively triggering vaccine hesitancy? He says he's not, but is that really true? Does Prashant Bhushan consider himself higher and more credible than all doctors and experts both here and abroad? That's why we even had a Johns Hopkins expert denouncing what he has said. With 2.2 million followers, doesn't Prashant Bhushan have a responsibility towards his audience, if not towards the country at large? Will Twitter or the government take action against Prashant Bhushan for this misinformation, or will things just be allowed to slide? Are the big questions. We've got some breaking news on one of those questions right now.